Health authorities are continuing to trace contacts of the COVID patients of the Kandakadu Rehabilitation Centre. Now, PCR tests are being carried out on those who have been traced. As per the PCR test results carried out in Rajangana and surrounding areas, 17 patients have been found. Now, 19 patients were reported yesterday. 9 of them were people who came in contact with those at the Kandakadu Rehabilitation Centre. 4 inmates of the Senapura Rehabilitation Centre have been identified as COVID patients. The other patients were returnees from overseas.
11 Grama Niladhari divisions out of 21 in the Rajangana area have been identified as areas which are at risk for the spread of the virus. The public health inspector in Rajangana said 248 families are currently undergoing self-quarantine. Accordingly, 1,016 individuals in the Rajangana area have been subjected to self-quarantine.
We have identified 17 patients in the Rajangana area in the Anuradhapura district. We have also carried out nearly 560 PCR tests. We hope to conduct nearly 100 PCR tests today as well. Even if these tests turn out negative, we have decided to limit travelling in the area and conduct PCR tests after a week. That is because we cannot be satisfied even if the tests showed negative results. Our observations reveal that the virus has spread across the Yaya 1, Yaya 5, Yaya 3, Yaya 6 and Yaya 18 areas.
A group who had associated the COVID-19 cases identified in the Varallavatta and Bandaravatta areas in Gampaha were subject to PCR tests today at the Gampaha Municipal Council Community Hall. Nearly 70 individuals were subject to PCR tests during the medical program, which was led by the Chief Medical Officer of Health in Gampaha.
මම හිතන්නේ පාලනය කර ගත හැකි මට්ටමක තියෙන්නේ ආසාදිතයෝ සිටියට ඒ ආසාදිතයෝ දෙදෙනා විතරයි දැන්ට පොසිටිව් කේසස් විදිහට තියෙන්නේ.
22 individuals of 6 families in the Andana Vattakanda area in Kahavatta were directed to self-quarantine yesterday. The residents belonging to the wife of the army officer attached to the Kandakadu Rehabilitation Centre is among the 6 houses. The number of police officers at the Sigiriya police have been limited. This was due to an officer of the Sigiriya police living nearby to an individual attached to the Kandakadu Rehabilitation Centre who tested positive for the virus. Our correspondent said a few police officers were also directed to PCR tests. Outsiders are not allowed to enter the Sigiriya police station. Complaints will be accepted opposite the police station by officers attached to the Dambulla police.
Thus far, based on research done closely with the University of Hong Kong, there has been no major change in the genetic makeup of the virus. Initially, the COVID-19 cases detected displayed symptoms of the virus. However, the subsequent patients we identified from the Navy following PCR tests did not display any symptoms of the virus. Many asymptomatic cases were identified from that cluster. Once again, we have detected small clusters which include both symptomatic and asymptomatic cases. The counsellor who tested positive for the virus recently had displayed symptoms of the virus. Even the prison inmate at the Valikada prison displayed symptoms of that virus, but it was only detected later after conducting a PCR test. At present, the cases that have been identified include both symptomatic and asymptomatic cases. We must be even more vigilant as there were travel restrictions imposed previously. We need to ensure the spread of the virus is under control. At present, several organizations are in the process of finding an injection for the virus. We cannot be certain on a timeline as to when an injection will be manufactured. An antivirus has not been found as yet. The only method to control the virus is by controlling the transmission of the virus.
පාලන ක්‍රමය තමයි අපි අර කිව්ව විදිහට රෝගයේ පැතිරීම පාලනය වීම තමයි ප්‍රධාන වශයෙන්ම ගන්න අවිය.
I have to say, with regard to this cluster, there are a number of ideas and opinions that have been expressed. This is actually a cluster that is concentrated at this particular centre. And from outside, there have been only 20 patients reported, all with connections to this cluster. All the other patients are from the Kandakadu Rehabilitation Centre. Out of 20, 16 are from the Rajangana area. Only 4 are from outside this area. There are rumours about patients reportedly being found from different parts of the country. There is also talk of there being strong communal transmission and the alleged start of the second wave in some cases. In studying this data, it is clear that there is no such situation taking place.
සඳහන් කරනවා ඒ කාරණා මේ දත්ත පරීක්ෂා කිරීමෙන් ඕන කිරු තීරණය එහෙම තත්වයක් ඇති වෙලා නැහැ කියලා.
The next few days will be very important. It is because the people of this country made great sacrifices and committed themselves from the 10th of March up until the 30th of April that we had no patients from society since the 30th of April. Especially those who worked at this Kandakadu Rehabilitation Centre have come on holiday and gone to certain places unaware that there are infected people in their camp. That is why all the citizens in the society should know that there is a situation like this. If you come out of the house, you have to wear a mask. As mentioned earlier, a mask should not be used to cover the chin but cover the nose and the mouth. At the same time, if you keep disinfecting hands and maintain social distancing as much as possible, we will be able to prevent a second wave from happening. His Excellency the President and the Prime Minister summoned the COVID eradication task force yesterday and instructed all officers in the task force on how this COVID situation should be controlled. The President and the Prime Minister advised all of us. In such a case, I do not think there is any space for anyone involved in this at this time to say that the political authorities are not involved. The Triforces, the police and the health sector too are working together to eradicate this wave of COVID from Sri Lanka. The GMOA convened a media briefing today to explain the current COVID-19 situation in the country.
We have identified many clusters at present, more than the discovery of patients in April and March. Therefore, the risk of the virus being spread is at a high level. We are at a critical juncture when it comes to public health. The future will be decided on the action taken by the authorities at the Ministry of Health and the Infectious Diseases Unit. At a time where the political assistance has also been rendered towards that endeavour, the situation will become worse if correct decisions are not taken. The committee that makes technical decisions regarding this matter should convene and make summaries and analysis daily. They at least have to convene once a week and analyse the situation. We have clearly stated that we should identify and learn from the mistakes we did in the Valisara Navy camp incident, but that did not happen. Therefore, we ask you to learn the lessons from the Kandakadu Rehabilitation Centre incident. Let us categorize small groups. Let us take steps to not mix them with others. The spread to a lot of people in a particular establishment can be prevented. Apart from the northern province, only a small number of patients are being reported from other parts of the country. The level of risk varies from province to province. We can opt for a zonal lockdown, then the effect will be less. We will be able to prevent the threat on an island-wide range if you can implement this in other parts of the country as well.
රටටම මේකේ බලපෑම එන එක අපිට වළක්ව ගන්න පුළුවන් වෙයි.
කොරෝනා වසංගතය සම්බන්ධයෙන් වැරදි තොරතුරු සමාජ
Spreading false information about COVID-19 has been a barricade for us to prevent the second wave from embarking. Reasons being, the relevant parties entrusted with providing us with the information not providing the correct information and false information being circulated on media. There is nothing called centralized in health. We are of the stance that the health process should be carried out under a centralized government.
පාලනය යටතේ සිද්ධ යුතු කියන ස්ථාවරය අපි ඉන්නේ.
This is the view of the Government Medical Officers Forum. For the past 7 months, the health sector, together with the government, managed the situation well. Ideally, for every 100 individuals, there would be 80 positive cases. However, at present in Sri Lanka, only about 20 in every 100 are displaying symptoms of the virus. Of the 20 individuals displaying symptoms, the condition of only about 1/4 of that worsens to the extent that requires treatment at an ICU. The health sector's responsibility is to ensure the general public will not panic. We urge everyone to adhere to health guidelines, maintain social distancing and always wear a face mask. When there are so many intellectual organizations in the country, it is a shame how a trade union held so many discussions. All members and parts of the Government Medical Officers Association are businessmen who work on commissions. It is a business in there.
130 කොමිස් ඉල්ලන්නේ ඒගොල්ලන්ගෙන්. මේක ව්‍යාපාරික වෙළඳ මධ්‍යස්ථානයක් බවට පත් වෙලා තියෙන්නේ.
The collective of civil society organizations and trade unions has stated that the risk of COVID-19 has resurfaced due to political expediency. The second wave of COVID-19 is upon us due to the undisciplined actions of this government. The government has come to the point of taking decisions disregarding health rules and regulations just because they want to secure a two-thirds majority. When the Director General of Health Services tells us to stay 3 feet apart, Minister Mahinda Amaraveera says that we will be allowed to travel as per the number of seats on the buses. When the Director General of Health Services told us to wear a mask, the police also told us to wear a mask. Then someone from health authorities comes and says that a mask is not essential. The advice of the World Health Organization was not sought. They did not follow instructions. They did not follow the instructions given by the technical officers of the Ministry of Health in Sri Lanka. Many patients are not found when the number of tests conducted is low. They even claim credit for the 80% that are asymptomatic. They also take advantage of the situation that comes with low testing. The government is trying to take the election process forward by hiding the real situation.